Why are some doctors and hospitals dropping Medicare Advantage plans? That's what we're going to talk about in today's video, so please stay tuned. So over the Medicare open enrollment period, I had several people call my office and tell me my doctor or my hospital is no longer taking my Medicare Advantage plan in 2024. What a lot of people don't realize is that this is probably more common than you think. So now that the busy season of Medicare is slowing down, I had some time to do some research and look into this a little bit deeper to share in today's video. And you can do this on your own as well. Just go to Google and search hospitals, doctors dropping Medicare Advantage plans. This particular story that I want to highlight to you today is from California, and it says this: two large medical groups shun Medicare Advantage plans. San Diego doctor groups latest to withdraw, citing low pay and prior authorization problems. The article says this: signaling what may be an emerging national trend, two influential medical groups with San Diego based Scripps Health are canceling their Medicare Advantage contracts for 2024 because of, now pay attention to this, low reimbursement and prior authorization hassles, leaving 30,000 enrolled seniors to look for new doctors or different coverage. So again, this is very common every year. It doesn't happen widespread, but usually it's in a particular part of the country where a provider and a health insurance company cannot come to a contract agreement about working together. And if you are on Medicare, about to go on Medicare, this is something you're going to want to know as you educate yourself to make the right Medicare decisions. The article goes on to quote the CEO, Chris Van Gorder. He said this: negotiations with the payers for Medicare Advantage with our medical foundation groups and Scripps Health were unsuccessful, and we have been forced to withdraw from those plans due to annual losses that exceeded $75 million. He said that the losses are due to, again, pay attention, low reimbursement, denials, and administrative costs to manage high utilization and out-of-network care. Again, he emphasized that about 30,000 enrollees will have to make a change in their coverage or pick another doctor. One thing I'll tell you is that when these types of things happen and people reach out to me and I talk with them, usually what they want is to keep their doctor. And so they're willing to change from one Medicare Advantage plan with one company to a different one in order to stay with their preferred doctor, clinic, hospital. Doesn't always happen that way, but I would say the majority of time it does. It says this: about 1,000 physicians and advanced practitioners such as physician assistants are members of the two groups. So think about that, 1,000 roughly providers working with these beneficiaries will no longer take Medicare Advantage plans. Van Gorder goes on to say, we certainly regret any inconvenience, but that kind and size of loss is unsustainable by Scripps. We will remain in Medicare Advantage with our IPAs, which is Independent Physician Associations, as those contracts are structured differently. And then listen to this, and of course, with traditional Medicare or original Medicare. The two medical groups again affected are Scripps Coastal and Scripps Clinic Medical Group. So again, if you are on Medicare or about to enroll in Medicare and you're trying to decide which Medicare plan is right for you, this is something that you're going to want to be aware of. Medicare Advantage plans and providers don't always come away from a negotiation in agreement to work together. And this happens pretty often, actually. I get these kind of calls or news stories, or someone will tell me that this has happened to them in different parts of the country. This particular story is California, but I've seen it in other states around the country where this happens. So this is something that you're going to want to be aware of as you make your journey to Medicare. Again, if you have specific questions about Medicare, you can certainly leave them in the comments below. Otherwise, you can reach out to me through my website. Again, it's meetjamie.com. If you like this video, please subscribe to the channel, hit the like button, and pass it along to a friend who may enjoy it as well. Thanks for watching. Have a great day.